Nearly half of the almost 30 million Americans who have diabetes complain of nerve discomfort. Diabetic neuropathy is a frequent and excruciating ailment brought on by the body's nerves being affected by elevated blood sugar levels. In extreme cases, the symptoms, which might include tingling, numbness, and burning sensations, may result in a loss of sensation or function. The quality of life and daily activities may be negatively impacted by crippling pain. Thankfully, there are several approaches to managing and reducing diabetic nerve discomfort. Keep blood sugar levels under control to prevent nerve damage. Controlling your blood sugar is one of the greatest strategies to relieve diabetic neuropathy pain. Over time, high blood sugar levels can harm the nerves, resulting in diabetic neuropathy. By routinely checking your blood sugar levels, taking your medications as directed, and adhering to a healthy eating plan, you may keep your blood sugar levels steady. Blood sugar levels can be managed by eating a diet strong in protein and fiber and low in carbs. Controlling blood sugar levels can also be aided by avoiding processed and sugary meals. Effective blood sugar control can lessen some of the agony brought on by diabetic neuropathy and help you stop more nerve damage. Take prescribed medications for nerve pain as directed by your doctor. It is crucial to speak with your doctor first if you are having diabetic nerve discomfort. In some circumstances, over-the-counter painkillers might not be enough to treat nerve pain. If your doctor decides that you need to take a prescription medicine for nerve pain, it's crucial to heed their usage recommendations. Drugs like gabapentin, pregabalin, and duloxetine may be administered in order to lessen the suffering brought on by diabetic nerve pain. It is possible to reduce the likelihood of adverse effects and increase the efficacy of your medicine by taking it as prescribed by your doctor. Be sure to alert your doctor to any changes or decreases in your pain levels at follow-up sessions. Exercise regularly to improve blood flow and reduce nerve pain symptoms. Exercise on a regular basis can aid in easing diabetic nerve pain symptoms. Sedentary living can cause muscles to weaken and mobility to decrease, which can exacerbate neuropathic pain. The blood flow to the limbs and nerve endings can be improved by exercise, which helps lessen discomfort and numbness. Regular physical exercise, such as walking, cycling, and swimming, can lower the chance of developing diabetes-related issues. It's crucial to wear the right shoes and check your blood sugar levels before and after exercise to avoid hypoglycemia. By selecting enjoyable activities that fit into your lifestyle, you can make exercising a habit and experience long-lasting relief from diabetic nerve pain. Apply heat or cold therapy to the affected area to help alleviate pain. The use of heat or cold treatment to the afflicted region is one efficient method for reducing diabetic nerve pain. While cold treatment is beneficial for acute or abrupt pain, heat therapy is ideal for long-term or chronic pain. Heat treatment can promote more blood flow to the injured area, which can lessen discomfort and relax tense muscles. A heating pad, hot water bottle, or heated cloth can be used to provide heat. On the other hand, cold treatment can assist in reducing edema and inflammation in the afflicted region that may be causing discomfort. For relief, try a frozen vegetable pack or a cold compress wrapped in a towel. It is important to keep in mind that neither of these therapies should be used often, since repeated exposure to heat or cold might injure the skin and nerves. Everyone has a different threshold for pain. so it is best to experiment with a range of temperatures to find the one that works best for you. Massage the affected area to increase circulation and reduce tension. Massage of the afflicted region is one of the most effective ways to reduce diabetic nerve pain. By improving circulation to the nerves, massage can assist to provide them the oxygen and nourishment they so desperately require. By reducing swelling and inflammation, this improved circulation can assist to lessen pain and suffering. Additionally, rubbing the region can aid in easing muscular tension, which can further aid in reducing pain and discomfort. Even though rubbing the region might be beneficial, you should see a doctor or physical therapist before starting any type of massage treatment, especially if you are experiencing intense nerve pain. For the most benefit, a skilled massage therapist can offer instructions on how to appropriately massage the injured region. Try acupuncture or acupressure to stimulate nerve endings and reduce pain. Alternative treatments like acupuncture and acupressure have been proven to ease diabetic nerve pain. Both treatments entail stimulating particular body locations that relate to neural networks. Acupressure entails applying pressure to the same points as acupuncture, which includes inserting tiny, sterile needles into the skin at particular locations along the route. According to studies, these treatments can aid diabetics with pain management and improved nerve function. Despite the fact that acupuncture and acupressure are usually risk-free, it's essential to make sure that your treatment is carried out by a trained expert in order to reduce any potential risks. It's also important to keep in mind that not everyone should use acupuncture or acupressure, especially if they have bleeding problems or take drugs that thin the blood. Add anti-inflammatory foods to your diet to help alleviate nerve pain. The main cause of diabetic nerve discomfort is inflammation. Including anti-inflammatory items in your diet can help your body experience less pain and inflammation. Whole grains, leafy greens, turmeric, ginger, berries, almonds, and fatty fish, such salmon and sardines, are a few examples of anti-inflammatory foods. You may reduce inflammation and get relief from nerve pain by including these items in your meals. A doctor or nutritionist should be consulted before making any significant dietary changes, especially if you have additional health concerns to consider. Practice relaxation techniques such as deep breathing or yoga to help reduce stress, which can worsen nerve pain symptoms. A major factor in reducing diabetic nerve pain is stress reduction. By inducing inflammatory reactions in the body, chronic stress has been found to make neuropathic pain worse. As a result, relaxing activities like yoga or deep breathing can aid in reducing stress and promoting relaxation. Deep breathing entails inhaling gently from the diaphragm and slowly expelling to relax the body and mind. Yoga, an activity that can help reduce tension and anxiety, includes stretching, deep breathing, and relaxing. For best results, include these relaxing techniques into your regular practice. They can reduce the symptoms of nerve pain. It might be difficult to manage diabetic nerve pain, but it's of the utmost importance to create a thorough treatment plan with your doctor and to adhere to it religiously. People with diabetic nerve pain can find comfort and improve their quality of life with the right treatment and management.